if you just take a broad brush and look at the regulatory activity that's taking place today, if you were to Google on any of these topics, you would see a number of articles. You see activity in Medicare Advantage, where specifically if you are looking to expand into a new market as a health plan, you no longer can attest that your network will be adequate. You have to demonstrate it along the way. And that includes requirements for showing the process you'll have in place for provider data accuracy. In Medicaid and in the CHIP programs, you're seeing a drive towards new and additional adequacy standards, both at the state level, right, and looking more closely at what's happening with provider directory information, but also federally as a condition for state participation in Medicaid and receiving their FMAP. So the stakes are high. Transparency and coverage, looking at machine-readable files as of July 1st, 2022, and publicly available data through those files about the performance of the health plan and the provider. In the world of the exchange, both state and federally, focusing on federally here, there are a number of new network adequacy requirements, and there's a lot of attention being focused on the utilization of the machine-readable files, specifically machine-readable directory requirements, where that accuracy requirement is elevated. Then there's the No Surprises Act. I'm sure we're all familiar with this, where the core of the No Surprises Act is to prevent surprise billing and to create a process through which a consumer who gets a surprise bill has a well-defined path to being charged only in-network, out-of-pocket expenses, right? But in addition to that, in the No Surprises Act, you have an entire section dedicated to provider accuracy and turnaround times that health plans have to meet to attest to their provider accuracy and also to make changes in their directory. And that is a shared responsibility between the health plans and also the providers in their network. And then you have the Department of Labor looking at, under a microscope, mental health parity. And guess what? They're looking at adequacy and accuracy together to be sure that the information someone has to access mental health services is also on par with their ability to access physical health services. So a lot of focus on regulatory activity, all designed to better protect the consumer, with a common denominator of being we need to improve the accuracy of information that ends up in the hands of consumers so they can access the networks that regulators have approved.